everyone, Abitan, and today I'm going to discuss about proper medical hand washing. So what's medical hand washing, by the way? Related to medical procedures, medical hand washing refers to hygiene practices. Hand washing, or also known as hand hygiene, is the act of cleaning hands using water and soap for the purpose of removing dirt and microorganisms before administering medicines and medical care. The purpose of medical hand washing is to protect the healthcare providers against topical infections with the patient's harmful microbes, as well as protecting the healthcare environment from the diffusion of such microbes, and also to protect the patients from topical infections and some cases from external infection caused by the harmful microbes on our hands. So by doing the proper manner of hand hygiene, this provides to avoid cross-contamination and risk of infection between the patient and the healthcare providers. We all know that hands are the primary carriers of dirt, viruses, and bacteria, as people often touch their eyes, nose, and mouth without even realizing it, which can actually cause the germs to enter into the body through eyes, nose, and mouth and make you sick. Some forms of infection can cause serious complications, especially for young children, the elderly, and for those who have weak immune system. In 1846, Ignaz Semmelweis, who made medical hand washing mandatory and discovered its effectiveness in preventing disease in hospital environment. So now I'm going to demonstrate and show you the steps to do the proper medical hand washing. These 7 hand washing steps, as advised by the National Health Service, are effective and straightforward for thorough cleaning. The recommended hand washing time is at least 20 seconds, so make sure you complete all the steps and don't rush through them. Wet hands, forearms, and elbows. And lather hands with soap, and then lather them from elbows to forearms using rubbing and friction in circular motion. Rub hands palm to palm in circular motions, rotate clockwise and anti-clockwise. Rub the back of your hands with your fingers linked through the other hands. Use your right hand to rub the back of your left hand, then swap. Link your fingers together facing each other into clasped hand, then rub your palms and fingers together. Cup your fingers together with your right hand over and your left hand under. With your fingers interlocked, rub the backs of them again. And close your right hand around your left thumb and rub as you rotate it. Then swap. Rub your fingers over your left palm in a circular motions. Then swap. Once you're done with these hand washing steps, you should then thoroughly rinse with running water and dry with a clean disposable paper towel or simply dry with clean hand towel. So washing hands properly can prevent or minimize the spread of germs that cause such diseases. Hand hygiene is a great way to prevent infection. Even healthcare providers are at the risk of getting an infection while they are treating their patients. So preventing the spread of the germs is especially important for those people who handle food or work in the medical field, but also an important practice for the general public. Review patient's record. Reassess patient's general conditions, responses to previous treatment, and vital signs, especially body temperature. Prepare and arrange materials appropriately. And do hand washing. Properly identify patient and explain procedure to the patient. Close windows, door, and screen patient. Put back blanket in place and remove top linen. Remove patient's gown correctly. Fill basin with cool water. Wet, wring out, and place wash clothes at axilla and groin region. Now bat extremities from proximal to distal part for 3 minutes each and pat dry. Assist patient to seams position and provide appropriate support. Pat back and buttocks using long firm stroke for 5 minutes and pat dry. Return patient to supine position. Remove washcloths from the axilla and groin region. Check patient's temperature.
If you found the one,
Provide patient with fresh new gown.
just went in love, yeah. I surround my soul with the positivity. That's why
Replace top linen and remove bath blanket.
worry about much. I think we should have some more fun. I still dream about the days when we were young. I'll take a hit and still finish in one, yeah, yeah.
Position patient as indicated and or as desired. Do aftercare and return all equipments. And wash hands. Recheck vital signs and responses. Indicate findings on the flow sheet and nurse's progress notes. Observe privacy at all times. Maintain body mechanics all throughout the procedure. Review patient's record. Then reassess patient's general conditions, responses to previous treatment, and vital signs, especially body temperature. Prepare and arrange materials within easy. And do hand washing. Properly identify patient, then explain the procedures. Close windows, door, and screen patient. Offer bedpan or urinal. Discharge urine and wash hands. If patient voided through diaper, clean it first and dispose it properly, then do hand washing. Lay bath blanket on top of the sheet and ask patient to grasp the top of the blanket. And if patient is unconscious, tuck it with the shoulders, then pull out the top sheet from underneath. Remove patient's gown correctly. Place a small towel under the head. Fill basin with water. Then have patient place fingers in water to test for temperature tolerance. Now place towel across the patient's chest and tuck it under the chin. Wash the washcloths and make a bath mitt. Clean the eyes with plain water. Use separate corners of the washcloths for each eye and wipe from inner to outer cantos. Then dry using the small towel under the patient's head. Wash and dry forehead, cheeks, and nose using the SZ stroke. Place bath towel lengthwise under the arm, then expose farthest arm. Now wash, soap, dry, and pat dry using long firm stroke from distal to proximal areas. Ensure to clean the axilla properly. Immerse patient's hand in water. Wash, soap, rinse, and dry, paying particular attention to the spaces in between fingers. Use orange stick if necessary. Change water if needed and repeat to the other arm near you. Fold or pull bath blanket down the patient's umbilical region. Then wash, soap, rinse, and pat dry the patient's chest using circular motion. And take special consideration with the patient's breast. Pull towel lengthwise over the chest, covering the entire main body frame, and fold the bath blanket just above the pubic region. Now bath abdomen, giving special attention to umbilicus and abdominal folds, using a circular motion with different corners of the mitted washcloths. Wash, soap, rinse, and pat dry. Now place bath blanket over towel and remove towel from underneath. Next, place towel under the leg and expose far leg by folding the blanket towards midline. Then wash, soap, rinse, and pat dry from distal to proximal using long, firm strokes. With one hand supporting lower leg, raise it and slide basin under the lifted foot. Make sure foot is firmly placed on the bottom of the basin. Wash, soap, rinse, and dry foot and toes, particularly and spaces between. Change water if needed and repeat again to the other leg near you. Turn patient to side using proper body mechanics, making sure patient is in comfortable position with no signs of distress. Then place towel alongside the back and buttocks. Ensure undue exposure of the buttocks. Now wash, soap, rinse, and pat dry from neck to back and buttocks using circular motion. Clean perineum. Wash, soak, rinse, and pat dry, then cover. Once done with occupied bed, assist patient to supine with no undue exposure. Then assist patient in dressing from affected to unaffected side. Now place new top sheet and remove towel underneath. Do aftercare and return all equipments. Then wash hands. And finally, recheck vital signs and responses. Observe privacy at all times and maintain body mechanics all throughout the procedure.